Hello everyone, welcome to Public Health Insights live Q&A, where we'll be answering your questions to get you one step closer to landing a job. My name is Gordon, your host for this live Q&A, and I'm joined by my dear friend LaShawn and our friend Dr. Sajjad Fazal. If you haven't already subscribed to our podcast, be sure to do so. It's a great resource for a variety of public health and global health topics, including the Sustainable Development Goals, social determinants of health, career and professional development opportunities, and perhaps most importantly, and why you're here, job search strategies and tips. So anything you can think of in public health or global health, we've likely covered it on our podcast. And if you have any topic suggestions for us, feel free to send those over to us by email or on social media. The links to the podcasts are in the chat box for you to subscribe at your leisure. So we invite you to subscribe to our podcast.
All right, perfect. Thank you so much, Gordon. All right, so for today's live Q&A, we'll be covering a bunch of topics, and all of you have probably already seen it, but I'll go over it anyways. So we're going to cover identifying your target job, traditional ways to job search, thinking outside the box to find jobs, and finally, closing that deal and shutting it down, securing those job opportunities. I also want to let you all know that we have a live giveaway, and we're going to be doing a special giveaway towards the end of this event. So I highly recommend y'all stay back and just wait till that live giveaway is announced, because it's going to be really helpful for your job searching as well. And again, like I mentioned, this is meant to be an interactive experience. So we encourage you to drop your name in the chat. Let us know where you're from, maybe what MPH program you attended or are currently attending, and just interact with each other and connect with each other. Because at the end of the day, when it comes to job searching, one of the things I will get into is you all need to network and meet new people, especially if they're in public health and global health. So use the chat box, and as we go throughout our discussion and cover different topics, feel free to ask specific questions. And just as a reminder, when you registered for this on Eventbrite, you asked us the questions that you were really interested about. So we compiled those questions, and we're going to go through them during this session.
Right. So while you're introducing yourselves and getting to know each other in the chat box, perhaps we should give you an opportunity to learn a little bit more about us. So my name is Gordon Thane. I did my undergraduate degree at Western University in microbiology and immunology. I later pursued my MPH at the same university, Western University, graduated in 2019, and now I currently work as a program coordinator for the Windsor-Essex County Health Unit. LaShawn, over to you.
Awesome. I see some Western alum there, so howdy to you as well. Yeah, my name is LaShawn Benedict. I did my undergraduate degree at University of Toronto, then did my MPH at McMaster University. My MPH at Western University, but then I went to do an MSc in Global Health at McMaster University. I currently work as a manager for Global Health Community of Practice, and I'm super excited to be here. And in addition to that, I'm one of the founders, myself and Gordon, of Public Health Insight. Go ahead, Dr. Fazal.
Thanks. It's good to be here, especially with this all-star team over here. So my name is Sajjad Fazal, and I completed the Doctor of Pharmacy degree from Manipal University. After that, I did the Master of Public Health at Western University. So we're all Western alums over here. And currently, I'm the Manager of Research Impact Communication and Evaluation at Crohn's and Colitis Canada.
Wonderful. Thank you so much. And just so you all have a chance to connect with us, I am dropping links to our LinkedIn in the chat box. So everyone here, feel free to connect with us and start building those connections like I mentioned.
Awesome. Thanks, LaShawn. And as fairly recent grads, right, we're very passionate about staying connected with the up-and-coming public health professionals and sharing our lessons learned in any way we can to enhance the field of public health. So that's why we're here. And now for the moment you've all been waiting for. So we'll be going through all those hundreds of questions that were submitted. We consolidated them into themes. And keep in mind that while we're focused on providing our lessons learned and tips for job searching in Canada, know that these can likely also be adapted to other contexts as well. So the first question, this is going to be sort of a rapid fire question. So the two of you, you'll give me a yes or no or maybe in between answer and a quick remark on why you said that. Fair? Okay.
Sounds
so the
good.
first question we have is, what is the current availability of remote work from home options in public health? And do you think this is something that's here to stay? So Dr. Fazal, what are your thoughts?
Yeah, I think there's good availability. And it's going to be here to stay, at least for some jobs. Yeah, that's how it is for us right now.
Okay.
I echo his sentiments completely. I echo his sentiments completely. I love working from home, remote work. It allows a lot of flexibility, and I hope it's here to stay. And I believe that there's a lot of infrastructure that has been created to allow that process to facilitate itself.
Okay. And so it sounds like remote job options are here to stay, but is it easy to find relevant jobs with a master's in public health after graduating from university in Canada? LaShawn.
I'll go with it depends, because it also depends a lot about, the environment of the different jobs available and also the work that you put in and the efforts you put in to find those certain jobs.
Okay. All right. Dr. Fazal?
Yeah, I think LaShawn is on the money. It depends on the type of job. If you're working as a public health inspector or something that leads to infectious disease, you probably have to be on the ground. But if it's something like a coordinator, policy advisor within government and health charities, yeah, you definitely get many remote jobs.
Okay, that's a good distinction. So after, someone's decided to pursue some kind of graduate degree and they want to know, are there any graduate degrees in particular that give you an edge in the public health job market? For example, a Master of Science in Public Health versus an MPH, or an MPH, general MPH versus a specialization, or something like Masters in Global Health versus a Master in Public Health. Is there anyone that stands out amongst the rest, or it depends? Or are you going to give me a cop-out answer again?
Who are you asking?
Dr.
Fazal, you go first.
Yeah, I think it depends. And again, I came back to the same answer. If you're looking at working in policy programs in general, then going for a general MPH like the one offered at Western would work. If you're looking at working specifically in epidemiology, then going for a Master's of Public Health like the one that U of T offers that specializes in epidemiology, or workplace health and safety, that would work. So I think it all depends on what you're interested in, what your goal is. If you're not working, someone will say, my dream is to work for the WHO, then probably better off doing a global health than an MPH, right? So I think it depends what your end goal is, and then you choose a program that way. However, this doesn't mean you can't work in all the fields with the programs. You can always adjust and move around.
All right.
Yep.
LaShawn.
Yeah, I agree. There's a lot of flexibility between these programs. And like myself, I did the Masters of Public Health program at Western and the MSc Global Health program at McMaster. They all taught a bunch of different core skills that can be useful for any different career within the global health or public health space. So it really depends on the types of skills you want, the type of careers you want. And like Lily mentioned in the chat, I think Lily completed an MSc in qualitative public health research or something along those lines. If you're focusing on qualitative research, maybe that is a good idea, and maybe that's your career goal. Maybe that is a good idea to specialize. But oftentimes what I find is a lot of people don't know what they want to do. So that's why someone like me has opted for a more generalized MPH approach.
All right. Thanks for those answers. So we have a question here, and I really like this question in particular because it's focusing on those underlying things that make someone a good public health practitioner. So the question here is, what are the essential competencies and soft skills for a public health career in Canada? So what are your thoughts? If you had to maybe name 3, what would those be? I'll start with you, LaShawn.
Great question. So I guess in terms of the soft skills, I would have to go with communication skills for sure, interpersonal skills. Realize that once you get into the workforce, you're not working with other students. You're working with people from all different backgrounds, experiences, cultures. So you want to be able to interact appropriately and professionally with everyone. So a lot of it has to do with your interpersonal skills. How well you get along with different people goes a long way. And then I would also say confidence, right? Like a lot of these things like job searching can be very daunting. And even in the workplace, like, you know, if you're just starting off, you could lack a lot of confidence comparing yourself to others. But I kind of advise against that and allow you to reflect a bit to realize that, you know, you're here for a reason. You did these different degrees. You have this work experience. You know, just, you know, you got to be a bit more confident with your approach. So those are the 3 soft skills I would mention. In terms of competencies, I just want to shout out, I think the Canadian government put out a list of 7 competencies or core competency areas that you can check out. I'll tag a link in the description right now, but that provides a lot of core competencies based on like 3,000 different public health professionals across Canada. So it's probably a solid set of core competencies to consider. And I'll drop that right now.
All right. Dr. Fazal.
Yes, I think I'm just going to give you a general answer for both sets of your questions with both parts of it. So communication skills, very important. In any public health field you want to work in, whether you're working in research or policy, you should be able to, you know, articulate your thoughts and get your point across. At the same time, you should be able to manage stakeholders who may not have the same goals as you do, right? So communication, number 1. Number 2, writing skills. Very important. Most often you'd be writing and justifying decisions or even writing an epidemiological report, for example, for infectious diseases. Very important writing skills. And by the way, if you're looking for a job, most likely they'll tell you to do a writing assignment, depending on which organization you go for. So you need to have good writing skills. And the third, I would say, is being analytical, right? Being able to analyze the situation, being solution oriented when something comes up, being creative. At the end of the day, if you are getting into the workforce, they're not looking for the same old story, right? They're like, okay, what value can you bring and how can you solve a challenge that we currently have? So yeah, those 3 things.
So that's fantastic. And even when people think of communication, they're thinking communicating with the media, you know, very formal written reports, but even everyday emails. I remember a couple months ago, I sent an email to my boss and he called me and said, I really appreciate how clear and concise your emails are, and it's clear what decisions have to be taken from reading your emails. So something as simple as communicating on a day-to-day with your colleagues in emails, so there's no ambiguity with what specific requests are, that alone can be appreciated by your employer. So that's definitely communication.
Absolutely.
All right. So before we move on, I just wanted to mention for those of you who just popped in that we do have this awesome podcast that you can listen to. I just put the link in the description. And I also want to let you know to stay tuned till the end to participate in our live giveaway, which is going to be really useful, especially for the topic we're talking about.
Indeed. So we've just talked about skills, competencies, availability of jobs. People want to know, you know, we have a lot of recent graduates who don't have a lot of work experience and they want to know how they can stand out in the market. So how can these current students or recent graduates market themselves in a way that it's attractive to a potential employer? Dr. Fazal, let's start with you.
Yeah, so the question is how they are going to market themselves, right? So there's a number of ways. I always am a big fan of LinkedIn. It's an amazing platform out there. And there's different ways you can use LinkedIn. First of all, basic things, set up a profile. Have a profile picture, let people know you're a human being, not a bot, right? Or a troll. Set up your basic details so that they know where you're coming from. The other thing is try to engage with other professionals, right? Comment on other people's posts. So, for example, I have a bi-weekly public health newsletter, right? Share your thoughts, right? And I'll obviously notice you, right? Everyone else will notice, like, oh, who's this? What are they talking about? What their ideas are, right? And the public health space is very collaborative, right? Most of us, like to interact, like to talk about a topic, go down a rabbit hole once in a while. And then at the end of the day, I would also say is the etiquette of DMing someone on LinkedIn. Now, I get requests from so many students every week who need assistance, and I do my best to set a time to help them out. We pull each other up. But it's odd when someone says, "Hi, I need help in terms of finding an MPH program." Well, that doesn't give you much to go with. I don't know what your background is, what your interest. So normally I'd ask, so what's your background? What's your interest? Like try to be very clear with what you need, what your ask is. Or somebody will be like, oh, I just want to connect because I found some of your content interesting. Okay, that's fine. But if you have an ask or if you need advice or mentorship or something, be very specific. First of all, say hello, introduce yourself, and then come with your ask. So then when somebody has to reply you, then they know exactly how to help you out and go forward. So I think those are some of the things that I would say in general, how you would stand out.
Yeah, no, I really like that response, and I am a big LinkedIn person as well. But I'm going to kind of take it back a bit as well. When we were talking about, marketing yourself with little to no relevant experience in quotations, I feel that many people have good experiences that they could, change and modify and frame in a different way that allows you to market yourself as a public health professional. Like, what are we talking about here? We're talking about core soft skills that you could develop from your classes, you could develop from your volunteer opportunities, you can get them from your part-time jobs or full-time jobs. We're talking communication, we're talking teamwork, we're talking collaboration, we're talking critical thinking, we're talking writing, we're talking communicating. Right there and then, those are fundamental skills as public health and global health professionals. So don't turn your back on those experiences that you have used. And especially the volunteering experiences. Many jobs ask for work experience. Volunteer experiences, in many cases, can be counted towards your overall portfolio. Make sure you utilize them and frame them in ways that showcase them.
If I think of one example, people do group work, right, in university. And they might be working with some other partners, right? Let's say you're in your college, you're working with other classmates in other classes. You might be working with some professors and maybe some external partner, right? The way you would categorize that and phrase it in your resume would be, I conducted stakeholder engagement with this many partners, right? But as LeSean said, we normally think, oh, I did group work. No. You did stakeholder engagement, and you can phrase it like that. So yeah, you're absolutely right. We need to just have that mindset, of transferable skills.
Fantastic. A lot of students or recent grads often sell themselves short, thinking that the experiences that they have are not valuable, or someone who has more experience is necessarily going to be the right person for the job. I've been in a lot of situations where they would consider the underdog for job interviews. And you have to play up what you're good at. There's things that you're going to be good at. I think I have certain strengths that someone 20 years in the job won't have, and I'm going to play up those strengths. And I'm also, one thing that often doesn't come up a lot is talk about how your fresh perspective would benefit an organization versus someone who's been in the field for 20 years, who might have blind spots, status quo, sightlines. That's very refreshing for an employer. Think about this. Put yourself in their shoes. They're working with, LeSean's been my employee for 10 years. He always does the same thing, for those 10 years. I really wish that he would adopt his methodologies to be better. And then you come right away in an interview with a solution to a problem that they didn't even tell you that they had. So you just have to think about what value you can add. Don't compare yourself necessarily to other people. Try to put your best self forward instead. So many jobs require, that base level. We always see that dreaded 2 to 3 years experience. And people often wonder what that means. So we have a lot of questions asking, you touched on it a little bit earlier. In those 2 to 3 years of experience, can someone count their undergraduate experience or their graduate experience into those 2 to 3 years of experience? And how would they do it? You talked about that framing around group work, of framing it as stakeholder engagement on behalf of that organization. And then that would then allow you to include that into those 2 to 3 years. Is that what your mindset is, Dr. Fazal?
Yeah, so I think you want to be quite careful. So you should be ready to slightly exaggerate your strengths, but you shouldn't be lying. or taking things out of context, right? So if you have done, like, if you work in a group and stuff and calling that stakeholder engagement, that's accurate, because that's exactly what you've done. It's just a play of words, right? If you have taken down minutes, right? If you have written down what's been discussed in a group and then you discuss later, that's taking down minutes in a meeting, right? That's the same thing. However, when it comes to counting years, I'd say if you're doing internship or practicum, or if you're volunteering, yes, definitely count it. The time you spent in class, I think that would be lying if you include that as your experience. But anything that's voluntary, that's let's say you're in school, but you spend the whole year working for an organization, like voluntary, that you include, right? Internships you include, and any other experience you do include it. And I think it's well received by employees. So don't sell yourself short by saying, "Oh, I just did an internship." No, you did an internship. That's work experience. Don't even put it in voluntary. Stick it right there up in your work experience. Yeah.
Yep, and that's kind of 2 points there. The first one is, when you have those volunteer positions, don't on your resume or cover letter say volunteer. What did you actually do? Were you a research assistant? Were you a public health? Whatever. Like, mention what it is. Don't sell yourself short. Like, oftentimes when you do your resume or cover letter, it's just relevant experience. It doesn't differentiate between specific types. Like, was it a full-time? Was it part-time? No, you don't need to mention that. But again, what Dr. Fazl's saying is also, you don't want to lie, but there's some room to play around with some of these words here. Yeah.
Perfect. And to that point, a lot of times, and I've spoken to recruiters as well, a lot of people put the position and then practicum student in bracket. No. For those 3 to 4 months, you were a research analyst. Call it a research analyst. The recruiter is smart enough to know this was a time window of 2 to 3 months. It was probably an internship. You don't need to spell it out for them. So that's just something to be mindful of. So should people, in those situations where people come up just a bit short, so you kind of talked about what should be classified as work experience and what maybe not so much. Should people be still going for those jobs that require 2 to 3 years of experience, even if they fall just short of that? What are your thoughts on that, LaShawn?
So, speaking from personal experience, I've applied to jobs that say 2 to 3 years of experience, or sometimes even more, and I've gone to interviews for those jobs. So there are other ways to showcase that you have what it takes. Specific job experience or working 3 to 5 years in and of itself is not valuable, but what kind of skills and wisdoms and learning opportunities can you bring to the table to a new organization? So if you show those intangibles off during, an interview, a cover letter, maybe you do some sort of certifications and stuff, those can kind of maybe counteract or balance that, right? And especially if it's in a case where it's, there's not too many people applying for that job, they will more likely to be considering you as a candidate. So from my experience, I'd love to hear from you all as well, but from my experience, I have applied to, positions that require more experience than I actually had, and it's been positive. But again, you want to take that, you want to be reasonable with that, right? You're not going to apply to a 10-year position or a 10-year experience position or a 5-year experience position. You also want to look at the skills that it takes, right? Are you going to be okay in that specific situation if you get the job? You know what I mean? So that's just a little caveat there.
Exactly. Dr. Fazl, over to you.
Yeah, I think LaShawn is very right. When you graduate, you're not gonna apply for a VP position, right?
Yeah.
You shouldn't. At least you shouldn't.
You shouldn't. Yeah. But he's right in the sense that you don't necessarily need that exact years of experience. So why don't we say? So I go for what I call the -2 rule. If it's 5 years and you have 3 years of experience, you're good to go. If it's 8 years and you have 5 years of experience, you're good to go. Or 6 years of experience, you're good to go. So whatever the number is, -2, you should be good to go. More than -2, you are getting into a situation where maybe you're stretching too much. Yeah. And the reason I would say if it says maybe 5 years and you have 3 years of experience, you should apply. Or if you just came from graduate and the 2 to 3 years they ask, can you apply? It's because it depends what type of degree you have. So sometimes let's say bachelor's degree, 5 years experience. However, if you have a master's, they already count that as part of work experience, right? If you have worked in that field or that specialization, they already count that. So yeah, so I would say have a judgment within, whatever the years is, -1, -2. If you have that much experience, go for it.
Absolutely. And there's little sort of sneaky things you could do to check this out too. So on LinkedIn, you could look to see what people are occupying those positions and what was the gap between their undergrad and MPH. Gives you an idea, did they get the job right after graduating from MPH? Did they have prior work experience? Because people tend to put most of that information on LinkedIn. Another thing you should probably look into as well is when they do these job postings, consider the region. So a place like, if we're talking about Canada, Toronto will be very competitive to the point where you have, maybe minimum experience 2 to 3, and then you have the pool is full of people with 7 to 10 years of experience because of the competitive job market. In another area, more remote area, they might be struggling because of the candidate pool to get anyone anywhere close to the level of experience that they want. So you have to factor in the position of power of the employer too. What options do they have available? You also have to consider a lot of times these job postings and these employers don't have realistic expectations for what a candidate is expected to do. So a good indication is the salary. So if they're saying 5 years of experience, but they're only going to pay $21, you know that they have an unrealistic expectation. $21, master's degree, 5 years, you know that they have an unrealistic expectation. So you automatically know people with 5 years of experience who have worked previously won't apply to those jobs normally. So those are some of the little things that you can use to make your decision on if something is worthwhile or not. Okay. Anything else to add to that before we skip on over? Okay.
I think that was a very good advice. Also look at the amount that they pay, and that gives you a good indication. And I would just say, if I have to add to that, don't just go for what the title is. I saw somebody being called a policy advisor to the executive director, and they were paying him, they were offering $50,000 for the policy advisor for an executive director, and I was like, whoa, that's way less for that type of role, for reporting to that kind of person, right? And so when I look at that, I'm like, okay, and then I look at the experience and like, oh, okay, someone with a bachelor's degree and maybe 4 years experience. So then you can apply. So don't just see, oh, it's a policy advisor, I should start as a policy assistant. No, organizations play around with wordings a lot. Coordinator, specialist, analyst, assistant, they could play around based on what they want, and that's not going to tell you the level. It's the salary and the years of experience that you should be looking at it.
That's right.
So related to that, actually, Gordon, is someone has a question. If they don't list the wage information, how do you navigate that? What do you think, Gordon?
You conduct some Google surveillance. So my strategy is I'll put in the job title. So ideally, you want to find an older job posting from that same organization where they may have listed the salary. That gives you an indication. Alternatively, there's certain websites that will give you a salary scale depending on what province it's located in. That's your second best option. The third best option is looking for the position in general, try to find similar regions. If it's Toronto, maybe look at Peel, York, and see what they're paying those positions. And you can kind of have an educated guess as to what they would pay. And this also helps you down the line in salary negotiations, which we'll talk about later. Anything you want to add to that, Lashan?
No, go ahead, Dr.
Faisal, go ahead.
So one of the best tools that I use is Glassdoor.
Mm-hmm. Glassdoor, that's the one.
Put in a position, put in the name of the organization, and you'll get salaries that range within that for that organization and other organizations. So if it's a health charity, compare that. If it's a government, compare that. But Glassdoor is very accurate. Like you can actually get an accurate value and range. So that's a good way of going about it.
And I think they even have comments on their people's experiences. There's one job I was going to apply to way back, and it was like, horrible place to work. And I'm like, no, thank you. And I just skipped it altogether.
Yeah, but also I guess with that, like, people love trolling online too. So you want to also take that with, a grain of salt. But that leads me to my next point of it might be a uncomfortable conversation sometimes, but you can also ask people you're comfortable asking, like, what type of salary ranges can I expect for a given position, given my experience, given my credentials. So it's okay to have those type of conversations with people you're comfortable with.
All right. LaShawn, were there any questions in the chat that you think we could get to at this point, or?
I think we're going to cover them eventually, so let's just keep going forward.
Okay, cool. All right, so when's the best time to start applying for jobs? So you start your MPH, maybe you did a 1-year program and you're in your second semester, or you're finishing up your 2-year program. When would you say is generally the best time to start applying for jobs? Dr. Fazal, I'll start with you.
Okay, I would say when you start your practicum, it depends. Like, I'm from the MPH program, practicum is 3 months. At that time, you start looking, get your, feet into the water, and by the time you're mid to end your practicum, that's when you would make sure you start applying. Please make sure you give enough time. Sometimes, especially if it's a government job, the application process takes a month. I know it's horrible, but if you want to work in the government, it takes a month. And it's bad, but hey, maybe when we become directors, we'll change that. But that's how it is, right? That's number one. Number two, keep in mind that not the first job you apply, you're going to get it, right? But when I was applying after the MPH or during my practicum, that means I had 2 masters, the pharmacy degree and the public health. So you'd expect I'd get jobs quite easily. But then again, I was an international student at that time, right, on a work permit. So I gave myself time. It took me 3 months, 100 resumes and cover letters submitted, all the way from political parties such as the Liberal Party, NDP, all as a policy analyst, all the way to, research coordinator. I just went crazy. I applied everywhere, all the way to New Brunswick. I was looking for a job, man. I was hustling. But then finally I got a part-time job. And then I went to a full-time job. Now I'll explain more about how I got the part-time job later when you talk about, talking to recruiters and stuff. But be open to put your foot through the door. Be open for a part-time role. It's easier to get a job when you have a job.
Absolutely. LaShawn.
Yeah, I'll quickly add my point here. So, so I agree with Dr. Fazal's answer there. I would also consider this idea too, though. You don't necessarily have to be applying for jobs at the beginning of your MPH program, but understand that it's also a good opportunity to create and cultivate things that will help facilitate the process later on. Now, what do I mean by that? Like Dr. Fazal said, create a LinkedIn, network with guests that comes to your program or guests at your current or people at your work. You could start doing that before a contract ends or your school ends. So build those networks and then they'll become handy. So you don't want to network as soon as you need something. You want to network ahead of time before you even need something, right? And that's how you develop those meaningful networks.
And I think one thing to add to that is don't network for a job. Network for a long-term connection with the person and the organization. It's something that we miss out. Even I missed out when I was first beginning. I networked with so many people, had a good chat and conversation. When it came time to getting a job, some of them weren't ready to offer a job. And that's because budgets, restraints, whatever. So keep that in mind. You're not networking for a job. You're networking to have a long-term connection with that person and the organization.
Absolutely. And, one thing I would just add too. So yes, the best time to start looking is around maybe after you've secured your practicum, before you even start it. But you have to be cautious because at this point, you may or may not know what you like. So maybe you're going to do a practicum in epidemiology and you're thinking at that moment, I'm going to apply for epidemiological jobs. You go to Public Health Agency of Canada. After your first 4 weeks, you realize, yep, I hate this. I don't like stats and I don't like data. So, during your practicum, as you start to discover a little bit more about yourself, is when you're in a best position to start applying for those jobs in which your interests and skills kind of align. So that's kind of the best place to start. And the timeline, you want to give yourself, I agree, 3 months. You want to give yourself about at least 3 months. It could move a little bit faster, but 3 months is a reasonable timeline. I applied, my practicum started in May 2019. I applied for jobs in June. And so the job that I got after my master's, I got that job interview in September after applying in June. And you have to realize, so in addition to, I know you mentioned about a month turnaround time, some positions that get listed, they put it out way before the vacancy is actually going to happen. So some of them move at very snail's pace. I completely forgot about the job offer, but or that I applied for that job. But that just goes to show that whenever you apply, you must save those job postings. Save those job postings because they'll get deleted from Indeed and whatever. And I know people who go to job interviews that don't remember what they applied for. I know this. This happens. So you always have to save, keep a spreadsheet, keep track of the jobs that you apply for, because they could come back to you in 2, 3, 4 months. Maybe their first candidate started a month and left, or they weren't able to get someone else. So you just got to be mindful of that.
Oh no, that's such an important point. Like, make sure you save it. And it's happened to me where, I applied to a position, a month passes, and then I get the interview and I'm like, what are the core skills? What do they want again? Like, I want to know just so I could refresh myself. But anyways, what I ended up doing is there's like tools online that I could link. It's basically like a time machine type tool where there's like internet archives available still that you could go back and retrieve those things that have been taken down. So that's the tool that I use to go back. But let's prevent that as public health professionals and just download it while you can.
Yeah. So guess that won't help you in every situation though, because some like London Health Sciences Center, they have secured career portals where it's not indexed in Google. Yep. And you're in a situation if you let those expire and you didn't save the job posting. I've seen people show up not knowing what they're interviewing for, and they're too embarrassed to ask. So don't let that happen to you. Okay. So what are some entry-level jobs that people can search for? What are those? Are there specific job titles, keywords that people can be searching for to know what's out there that fits within the scope of a recent graduate? Dr. Fazal, let's start with you.
Yeah, okay. And I think LeSean will be able to give a more recent answer for that. So I would say research assistant, research associate, policy analyst, policy assistant. You could, depending on how much previous experience you had before your MPH, apply for coordinator jobs. If you have like a medical background and you do your MPH, you could also do a specialist kind of job. Look at the number of experience, the number of years of experience. If it's around 2 or 3, yeah, go for it, right? That's the type of job you want. On Indeed, you have a nice feature there. You can just write entry level, right? And then it filters out the jobs for you. But in terms of field, any field you can work, right? You could work as an assistant in any field or an associate in any field, and you grow from there, right? It's all about how you present yourself, and yeah, that's what I would say. Over to you, LeSean.
I totally agree with all those, suggestions that you had, and I would also just, check out different job forums or like within your school's practicum positions, they might post specific job titles, and you could use that as well. On your journey to find specific keywords, etc. And I have a whole digital marketing spiel I could go into, but I'll spare you from that. But in a nutshell, you could use like Google keywords to just help you find keywords that people are typing in or key job terms you could help use.
Yeah. And let me tell you one thing I did when I was in my when I was doing my MPH. I met with hiring managers from the different health units at various conferences, and I said to them, what public health jobs are most accessible for recent grads? They told me health promoter, so I tailored my whole practicum experience to get a job in health promotion. And what did I do? I got a job in health promotion. But before you even do that, one thing I did before I even accepted entry into my Master of Public Health program is I asked a career coordinator to send me a spreadsheet of all the job titles for public health positions, and I indexed them, and whenever I search, I type those names in. So, but where do you search? Is Google the only place to search? So, LeSean, I'll ask you, what are some of those places that you go? What are the best platforms to use when you're in the process of job searching?
Okay, I'll list out a couple here. So the first one I would kind of say would be this idea of there are many professional groups on the internet. Like, for example, if you're into global health, the Canadian Association for Global Health, they have a young professional network that you can kind of enroll in, and they have affordable membership pricing since we're early career professionals. It's a great way to network with individuals at different stages of their career, and who knows where that could take you. Great networking opportunity. Then, one thing that is often said, but not really expanded upon, is this idea of using LinkedIn. We get the idea. Dr. Fazal mentioned, so great to network with people, connect with people, and be strategic in that approach. But on LinkedIn, there's actual specific features you can use, okay? So if you log on to LinkedIn right now, at the top of your screen, there's actually a section dedicated to jobs, okay? Click that section. What you'll find is a search bar, and it'll say search by title, skill, job. Use that. Type in public health. Type in all these keywords that we're telling you and talking about. And what you'll find is a list of job applications, job descriptions that you can see. And you could see people who applied, people who, are affiliated to those organizations. It literally lays it out all for you. And you can filter by different things like location. You can filter by, does it have easy apply? Easy apply is basically a feature on LinkedIn which helps you push out a lot of applications. So you could filter by that. And basically, if you click that option on any given job, it'll send your LinkedIn profile. And ideally, it's well done and, filled out properly. You could fill it in and then click that easy apply button, and boom, right? You apply to that job. Sometimes they'll ask you to attach a resume, but it's super quick and seamless, right? So you could filter by a bunch of different things. So that's the second thing. The third thing I want to say is this idea of vertical search engines, okay? Vertical search engines are search engines that are dedicated to a specific topic, okay? In this case, we're talking about job searching, job postings. So what these vertical search engines do is they feed information from a bunch of different job postings, job boards, and they have people actively bringing in job postings that you can look into. And again, with that, there would be certain keywords you type in, filters you could apply, geographic, is it a remote job? There's different filters depending on what you want, right? So you could really tailor it, but people don't actually go through with the process. So I'm going to drop 3 links here to 3 of the top vertical search engines that I use to just keep track of what's going on in the space.
Absolutely.
So, yeah, there it is.
All right. Thank you for that, LaShawn. And that's a bit of a perfect segue to talk. We've talked a lot about LinkedIn. We talk a lot about networking. So in terms of while we're applying to jobs online, the best practice is to also network because you never know what opportunities are out there. So do you recommend, how do you kind of get your feet wet in networking? You mentioned, Dr. Fazal, you mentioned about the first thing to do is to send a nice direct message to get the conversation started, comment on people's posts and things like that. So where do you take it from there? Do you go about setting up informational interviews with other public health professionals to learn about the jobs? Do you even message recruiters for those organizations that you're interested in, hiring managers? Where do you stand on that?
Yeah, it's a good question. I think each one of us has a different way of going about it. I would usually say that it's good, first of all, to look at someone's profile before you connect with them, right? See that person, because public health is broad, right? If you're interested in a specific field, then you connect to that person who's in that field of yours, right? Like, I don't work in epidemiology. If you connect with me and say, hey, Dr. Fazal, I want to work in epidemiology, I can give you guidance, but I'll probably end up saying, hey, this colleague of mine is in epidemiology, might as well speak to him. He's going to give you a better understanding, right? So look at what people's fields are or specializations are, and then connect them based on what you are interested in, what you want to do or get into. That's number one. Number two, I would say, do engage with people with their posts, commenting, liking, having that discussion. Because again, you're not networking for a job. You're networking for the long-term connection. Simply, just for example, somebody who's going to be connected to, let's say, LaShawn, Gordon, and I on LinkedIn is probably going to get visibility, and is probably going to get to see more job postings. Because Gordon sees a job posting from his network and clicks like, it's going to show up on everyone who's connected to you. Same here, right? And so you get to see more jobs. Not only like getting a job from that person, you get to see more jobs. And the other thing is, yeah, after you have a connection on LinkedIn, you can do an informal interview. Like usually when someone asks me a bunch of questions on LinkedIn, I usually send them a doodle poll and tell them, okay, this is my doodle calendar, slot it in and we can have a chat because it's easier. I mean, I prefer that to texting. But it's always good to have a discussion and a conversation with someone. And no, in the conversation, don't ask for a job. Ask for how is the work culture. Like really ask as if you want to work there. What are the things you want to know? What is the work culture? How do things work? What are some of the important projects, right? And after you get all this information, then you can make a decision whether you want to apply. And sometimes do tell them, I'm looking for a job. Can I send you my resume? After having that relationship. And there are people who would say, yeah, send me your resume and I will look at what's there. So I think that's the other thing to keep in mind.
Yeah, no, definitely. And I guess one thing I would just cap that off with is, engaging with your network meaningfully. One of the things that we created at Public Health Insight is this idea of office hours. So it's basically booking a free 30-minute session, usually myself and Gordon chatting, and you can network with us, talk about different opportunities in the space, and it's a one-on-one session. So we've had hundreds of people at this point join these sessions with us, and they benefited greatly. So I'm posting that link right now so that everyone else can benefit from it and book a time.
Perfect. And one idea, I in doing this for a while, Lashawn, office hours, talking to students, one of the things we often learn is that when people hear the term networking, they think of cold calls, sort of, people that you've never met before. But what about networking in a place that you're already working at? So there's an organization that you're doing your practicum, you're doing your internship, co-op, volunteer, you're already doing it there. How do you go about networking within that organization to find out about job opportunities that exist? Lashawn, you can start.
Yeah, no, I love that question, and it's something
you
I
might
do
have
quite
you might
a
have
lot.
done something like that.
Yeah, no, exactly. It's exactly what I did. And, coming out of a practicum position after my master's, or like while in it, I was starting to talk to people within the organization. I had my supervisor. I actively asked my supervisor, who do you recommend that I talk to gain more information about the field or specific types of job? In that sense, your supervisor. You have one-on-one conversations. They ideally want the best for you. So they're willing to connect you with people. They're not a cold contact. They're a warm contact, right? So then that helps facilitate the next conversation. And that could lead to something else, right? And with that in mind, at least for myself, I've always thought about how I can add value to different people's workflow or the things that they're doing, through project management, through digital marketing, or through our podcast that we have. A lot of public health and global health organizations love public health and global health, obviously. They have different messages, services that they have. And what better opportunity than collaborating with someone with a podcast who has a big network in a podcast. So I use that as my leverage in point to have these deeper, meaningful connections. So not saying that everyone should get a podcast and try getting people, hustling in people into joining their podcast and coming on as guests. But what I'm saying is you have to find your own niche, and you don't necessarily have to bring the value I'm saying. As long as it's a warm connection and you're open to having that conversation, people will appreciate that, right? And don't ask for a job, like Dr. Fuzzle said.
Over to you, Dr.
I think you're
Fuzzle.
right, Leshon. Yeah, one of the things that I have done, so I did my practicum in an organization, and then I kept in touch with my supervisor. We are still in touch today. That is every once a year or once in 6 months, we have a chat. I send a nice holiday greeting card. I send a nice holiday greeting card to every boss I've worked for, right? To keep that connection going. And see, I'll tell you one thing. As much as we want to hustle, and it's our hard work that gets us to where we are, it's also that person taking a chance on you. That person saying, I'm trusting, he's going to do a good job. And that gives a lot of empathy and gratefulness. We should be grateful that this person chose me compared to 100 other candidates, right? And for that, I always keep my connections nice and warm. But now, these days, at least once a year, I actually do consulting work as an independent consultant for the organization. From that same supervisor who was like, oh, he did a good job last time during his internship. Now he is grown. Why don't I engage him as a consultant? And while that's not my day job, it's still a source of income, and it's a way for me to create an impact and make more connections. So always think of that.
Fantastic. Never, ever discard your networks. And I think all three of us can attest to the fact that, places we've moved on from years ago, we're still benefiting from maintaining those connections. So it's invaluable to maintain those. So as we're winding down here, we had some questions about some folks have broken through those barriers. Some folks have applied to those 2 to 3 year experience jobs. Some folks have made it to the interview stage. So what advice would you have to someone who has been getting interviews but not receiving any job offers? And LaShawn, I can let you start with that one.
Yeah, I'll go quickly. I mean, I think it's a great step that you're getting your interviews. Like, clearly your cover letter, your resume seems to be working relatively well. Now, maybe it's time to think about how you can improve your interviewing skills. And maybe it's the type of questions you're asking. Maybe it's the enthusiasm level that you have. I've interviewed several people who just don't seem passionate about it. It's like they're here as a chore. I much rather have someone who's passionate and is visibly like really engaged and wants to genuinely know more, not someone who necessarily asks a question like, how long do I have to work every day? Is like, like those are not the best questions to ask if you're super passionate and dedicated. It is something to ask in the future going forward maybe, but not at that specific moment. So just have a little reflection session. There's a lot of YouTubers online that offer, career advice, interview advice, like Richard McMunn, Gordon's favorite. So there's a lot of resources out there to help you nail down that interview part.
I think LaShawn said everything that's there. I would say, work on your interview skills. Be passionate, but don't be too passionate. And I've seen this. There is a point where you become too passionate. You come off as somebody who's not very professional or very, let's say within the system, so to speak, right? Yeah. Also be cognizant of what type of job you're applying for. If you're applying for governmental positions, then there is a level of patience that's required. You're not going to get a policy go up through and get implemented within 6 months. That's not how government works, right? So if you're there all gun-ho, they're probably going to look at you and be like, is this person a good fit compared to if you work for a startup where they're looking for all those, right? So be passionate, but be professional. Look at who your interviewer is, and then measure your responses accordingly.
Absolutely. And just real quickly, a lot of times people don't understand the job. So I think we all can attest to, being part of even conducting interviews, that you often wonder, wait, am I in the wrong? The person actually doesn't understand the job. So the job posting is there for a reason. It details what you're expected to do on the job. If you're getting interviews but not getting the offers, perhaps you communicate in writing that you're the best candidate, but when you come to the verbal communication part, you're not able to articulate why your skills can achieve whatever objectives are on the job posting. So that's something that you might have to work on articulating. Now,
I just want to add one thing.
Yeah,
Gordon,
go ahead.
That people shouldn't feel discouraged though, because sometimes you apply for a job, there's already an internal candidate waiting for it. So just want to put that out there. Like, don't be discouraged. You do your best, improve yourself, and you'll get there. Not every job was meant for you. There's already an internal candidate, but they just have to go through the process.
All right. And before I go to the last question, LaShawn just has a quick announcement.
Yeah, no, I just wanted to say that stay tuned till the very end till we do the live giveaway. So just bear with us, and we'll be announcing that shortly.
All right. The last question we have here is around salary negotiation. One of the most cringeworthy things for people, one of the most uncomfortable things for people to do. So is there a right way to go about salary negotiations, Dr. Fazal?
Okay, I would say there are multiple ways to work on this. So first of all, if you don't know, you should have a figure in mind. You should have a range in mind before you even applied for the job, right? You should have a range in mind that this is what I'm expecting. Then you go, you finish your interview process, they're happy, they give you an offer. Look at the offer and see whether it is within your range. Are you happy with it, right? If it's not within your range, or it's in the lower end of your range, have a conversation. I would say it's probably good to do it over Zoom or a phone call rather than an email, but you can send an email. My first negotiation was by what I was like, I'm really excited for the role. I like the position. I looked at what the comps are, or you could just say that I was expecting to get this much, taking into consideration my years of experience and that I have these skill sets, and I would appreciate if we can have a discussion about it. And so what happened to me was I had an amount, then they came up with a counter offer, which was better than what was originally there. So good thing to keep in mind is usually people do have a range, and what they offer you, maybe they can go 5, 10, 50% above. So always negotiate. Sometimes they expect people to negotiate, but no one negotiates, and they're like, "Hey, we saved a few bucks here and there, right?" That's how HR works. So always be, and I used to feel when I did my first job, I used to feel, oh, what if they say no? Then how is that going to be with my relationship with my employer? There's nothing to fear. There's no harm, right? You negotiate and they say no, and then it's up to you to accept that offer or to not accept that offer. There's no fear or something bad for you just asking. More likely than not, you'll get at least a smaller bump.
Right. I'll give you the last question in a sec, LaShawn. Just a quick mention of that. It's just about the stage that you ask the question. You're offered the position, so it's appropriate at that point to negotiate. If you're talking about someone offers you an interview and you're like, wait, but how much does it pay? You're running into a lot of problems there. So it just depends on, if you're the best candidate, you're in a position to negotiate. It's called negotiation for a reason. LaShawn, real quickly.
Negotiate after the offer, not before.
After the job. Real quickly, LaShawn, is there something, can you take positives from rejections from jobs? Is there any positives that can come from, lessons learned from job rejection?
Oh, yeah, 100%. I mean, it really allows you that chance to reflect on that whole process and start to analyze different aspects of what went right, what went wrong, what I can improve on for the next time. And it's always one thing I always do. And if you're comfortable doing this, you could always message or email the person who interviewed you and maybe ask them, did you have any sort of feedback for me? Especially if you're applying for a practicum first type job, it's a really good thing to just get that feedback to know what you're doing wrong. You could think all you want, and you might think you're right of why you didn't get a job, but it's best to find the root of why something might not be working out, right? So perfect. I would, send out an email. Yeah. Yes, and with that, thank you all so much for attending this live session. As I mentioned, we'll be having another event on April 7th. So follow us on our social medias, keep in touch. Follow all three of us on LinkedIn. I know we put the links in the chat, so if you scroll up, it will also be there. And I hope you all had a great session, and we look forward to connecting